I'm really happy to be introduced by him because he has been my mentor since my trainee days in the Department of Urology Eastern Hospital. So my topic today is the risk factors in focused distant breast cancer recurrence. I'm going to share with you our local data, which was done by the Hong Kong Breast Cancer Registry. And you know, this year is the 20th anniversary of the Hong Kong Breast Cancer Foundations, and the Hong Kong Breast Cancer Registry is 2 years younger. And let's see what our data tells us today. So my topic outline will be present the data on the risk factors for the recurrent metastatic breast cancer, followed by the take-home messages for public health considerations. So as we all know, breast cancer is the biggest cancer threat to Hong Kong women. So we have over 5,000 breast cancer new cases every year. This is implying that 1 in 13 ladies or men are going to have the lifetime risk of invasive breast cancer in Hong Kong. For those who have not attended the talks today by our Singaporean colleagues, and their incidence is around 2,000 something with the populations of around 6 million. So it is a really serious situation in Hong Kong concerning breast cancer. For the Hong Kong Breast Cancer Registry, as I've alluded to, is around 18 years of age. And for now, we have 66 participating cancer sites for providing data to our registry and covering regions for all the Hong Kong territories, including the Hong Kong Island, Kowloon, and New Territories. We have collected over 31,000 patients with their data in our registry. So what did we detect? So concerning the cancer stage at the diagnosis of over 20,000 ladies with the time of collections between the 2006 to 2018, we have 80% of our ladies being under the stage 0 to stage 2, meaning that 80% of ladies are diagnosed to have early stage breast cancer who are curable. When including the stage 3 disease, we have 93% of the ladies. So a majority of breast cancer in Hong Kong can be potentially curable. For those patients presented to us, majority of the ladies, 80%, are detected by self-recurrence. So what does it mean? So if we can detect the disease much earlier than what they can feel and palpate it, then maybe the ladies can be detected at a much earlier stage with a potential higher chance of cure. We have the different breast cancer subtypes, as we all know. Around 80% of our ladies, they are diagnosed to have hormonal responsive disease. That means hormonal receptor positive status. In our study, we defined the recurrent metastatic breast cancer as that with the primary disease in the breast and spreading to distant organs. And the proportions in our study include those to have a potential curable stage 1 to 3 patients at the time of data collections. And we found that the proportions of distant recurrence in those stage 1 to 3 patients are increased with increasing follow-up time. So what did our local data tell us? The 10-year overall survival of Hong Kong patients are around 80% of the patients are having stage 2 or below. They are having 90% chance of cure. So this is our local data, and which is the efforts of our surgeons, oncologists. And for those patients with stage 3 disease, you can see that there is an immediate dropping of the survival down to the 74%. Concerning the median time to distant recurrence, we have around the patients with a median time of 4 years that they are going to recur with distant metastasis if they happen to have recurrence. And we also found that the distant recurrence did occur after 15 years. Let's do a revision. So this is a landmark paper published in the New England Journal of Medicine with the data under the Early Breast Cancer Trial Collaborative Group. And for those patients with endocrine receptor positive disease, they noticed that the chance of recurrence still happens after the initial period of the adjuvant hormonal therapy. And for those patients with NOC-positive disease, and it is differentiated that for the recurrence rate, it happened across the period after 5 to 20 years. And the risk is increasing for those with a higher T staging and N staging. And given the TN status, the factors of tumor grade, Ki67 status were of only moderate independent predictive value for distant recurrence, and PL and HER2 status at that time without the use of trastuzumab was not predictive at all. So nowadays we have effective anti-HER2 cancer treatments, and these patients can have potential chance of better prognosis nowadays. For those patients with a potential cure, we detected that over 75% of the patients are worrying about their disease recurrence, and this happened especially in the younger ladies of less than 40 years of age. The salmon paint color is showing that the proportions of patients are feeling worried about their disease recurrence, and the green are not. And for those patients who are older and more than 70 years of age, they are less worried comparing with the young ladies, but it did happen as in a half-half proportions. And the worrying of the fear of disease recurrence does not limit it to breast cancer patients. In our local study published by the Hong Kong Polytechnic Universities, and they did a systematic review and meta-analysis and showed that from the over 2,000 studies and 15 studies involving the caregivers, around 45% of the caregivers, they're worrying about the disease recurrence and together with the patients. So having a breast cancer is really a worrying factor to the life of our breast cancer survivors. So our study objectives is to examine the factors related to the risk of distant recurrence, and to examine the factors related to the time to metastasis, and to assess the survival outcomes of those patients having distant metastasis by the biological subtypes and cancer stage. And we hope to provide evidence for improving the breast cancer control plans and surveillance plans in Hong Kong. Concerning the factors related to the distant recurrence risk, what did we find? From the data of the patients who were diagnosed with the stage 1 to 3 breast cancer patients between 2006 and 2013 and underwent breast surgery, and we did a case control comparisons on the patients and tumor characteristics. We identified 2 groups of patients. One is the control group of 3,619 patients who had no recurrence for at least 10 years, and we have cases of 611 patients who experienced distant recurrence within the 10 years. By the comparisons, we noted that more advanced stage were related to distant recurrence risk. This is a graphical representation. The purple is meaning stage 1, the blue stage 2A, green stage 2B, and the salmon pink is the stage 3. And you can see that a significant proportions of the stage 3 patients are among the cases. So more advanced stage were related to distant recurrence. And other factors related to distant recurrence include age, younger than 40 years old, high Ki67, high tumor grade, and presence of lymphovascular invasions are other risk factors that were associated with distant recurrence risk. Concerning the biological subtypes, and we study these 2 groups of patients, and from the graphical representations, the purple is the HER2 negative hormonal receptor positive patients, and the blue is the HER2 positive hormonal factors positive patients. The green are the purely HER2 positive patients, and the salmon pink, the triple negative breast cancer patients. And the biological subtype was not related to the risk of distant recurrence. When we did the multiple variable analysis, we found that age, cancer stage, tumor grade, and lymphovascular invasions were independent risk factors for the distant recurrence among our study populations. Now let's move to the time to metastasis and related factors. The methodology is we define the three groups of patients in terms of the median time of metastasis. So the median free intervals are divided into three periods. The first is the 2 or less than 2 years. The second is the 2 to 5 years. And the third group is the more than 5 years. So the summum pain is the recurrence finding of less than 2 years, around 20%. And 43.5, around 40% are those between 2 and 5 years. And 37, around 40% of patients are more than 5 years. So these are the late recurrence. We noted that for patients having a short median free interval of metastasis were those of stage 3. So when the patient is diagnosed to have stage 3 right at the beginning, they have a chance of recurrence at an earlier time to be detected when they are bound to have recurrence. And for patients with short median metastasis-free period are those with more grade 3 disease, more nodal involvement, and the more triple-negative breast cancers, meaning that for those patients with triple-negative breast cancers, we need to pay more attention on their follow-up surveillance. And this is a comparison of the biological subtypes of our study populations regarding the metastatic free interval for the different biological subtypes. And we noted that for patients with having a triple-negative breast cancer, they have the shortest median time to recurrence if they're bound to have recurrence, and the time period is around 28 months. And for those patients who are luminal A and hormonal receptor positive and HER2 negative, the chance of detecting the metastasis is more than 5 years. So these are the late recurrence group if they are bound to have recurrence. So this picture is a bit busy, but let me guide you through. And we have the 4 different colors. The purple is a stage 1 disease, and the green is the stage 2A, and the blue is the stage 2A, the green is the stage 2B, and the summum pain is the stage 3 disease. And for the x-axis, we divide those patients into luminal A, the hormonal receptor positive, HER2 negative, the luminal B, the hormonal receptor positive and HER2 positive, and the HER2 positive group and the triple negative group. So across all stages, apart from the stage 1 disease, and triple negative breast cancers has the worst or the shortest median metastatic free interval for the stages among the subtypes. And across all stages, triple-negative breast cancer is also being the worst biological subtypes across the stages. Concerning the survival outcomes of those patients having detected distant metastasis, so what is the pattern of the disease? So we studied their overall survival, which is defined at the time from the cancer diagnosis to the death from any cause, and the metastatic-free survival from the time of cancer diagnosis to the distant recurrence. And after the distant recurrence, we have the period to the time of death as the post-distant relapse survival, the PDRS. And we collected the patients with at least a median follow-up time after the diagnosis of having 83 months and having the median follow-up time period after the disease recurrence of 23 months. And this is our findings. And for those patients having a hormonal positive and HER2 negative patients, stage 3 patients would have the poorer overall survivals and the median free survivals than the earlier stage disease. And for those with triple negative breast biological subtypes, the higher stage would have a poorer overall survivals and poorer median-free survivals, and it happens for patients having stage 2 or above. Concerning the PDRS, the 3-year PDRS for the triple-negative breast cancer patients was the poorest among the different breast cancer subtypes, with a median time of 14 months. That means around 1 year or so. So in conclusions, the factors related to the higher risk of distant recurrence and shorter time to metastasis include more advanced stage, especially stage 3 cancers, the high tumor grade, and the involvement of the nodal conditions, and the biological subtype would affect the time to metastasis, but not affecting the risk of distant recurrence. And early stage patients had better survival outcomes than later stage, especially stage 3. And early detections and regular follow-up care are crucial, especially for younger women. Bear in mind that 3/4 of these younger women, they're worrying about their disease recurrence, even though they have a cure after the initial treatments. And more education is needed to enhance the breast cancer awareness. This is a potential challenge, and for those who didn't attend the morning sessions, even in some countries having a national free breast cancer screening programs, still a significant proportion of patients, they did not attend the screening program. So we still need a lot of work to do to help our patients to be detected and to have appropriate treatments after the breast cancer. So the take-home messages to the public is we need the early detections to reduce the distant recurrence risk, to have more early stage at the time of presentations, and to identify patients who are potentially at higher risk of distant recurrence can guide our treatment decisions to lower the risk, as we have now newer treatment weapons for those patients with different disease subtypings, and to identify a subgroup of patients with different time to metastasis may tailor-made the intensity of surveillance approaches. So early detections, appropriate treatments would lead to better survival for our cancer patients. I would like to thank the opportunity for being included in the Hong Kong Breast Cancer Registry, and I would like to thank our patients who give consent for us to study their data. And special thanks must be given to the Hong Kong Breast Cancer Registry Steering Committee involving of around 30 experts in our local regions, and led by Dr. Polly Zhang, Dr. Yao Zhenzhong Yisang, and Dr. Lawrence Lee. And we have also a strong research team at the back of us to study our data. And last but not least, I need to thank our two leading foundation ladies who created and developed the Hong Kong Breast Cancer Foundations, and within which we have the Hong Kong Breast Cancer Registry. Thank you very much.